Well, I was referred here by Dr. Cecilia Hines, who is a dentist. In fact, she was one of the dentists who has been volunteering and won awards for being Volunteer Dentist of the Year a few times. And she comes and does exams on patients, and she still is active at this clinic, which is a great thing. But she referred me here, and after I moved here from Ocala, Florida, I sold my practice and my house and moved here to be closer to my grandkids.
Oh, wow.
And I have two children. They both live in Pensacola here.
Okay.
They're both married, and I spend a lot of time with my grandkids.
What kind of person, regardless of what your profession is, does it take to want to volunteer at a clinic?
Okay. Well, the clinic provides a more comprehensive setting than possibly just going to I've done a few Florida Missions of Mercy, and the quality or the consistency for the patients is sorely lacking at those. Here at this clinic, we can provide a more clinical environment where although we have multiple dentists volunteering here, and we always need more, so we're grateful for the dentists we have. This setting helps you provide more comprehensive care, which it's more rewarding when you can take a patient and try and restore their health so that they can get a job or recover from addiction problems that they've had in the past. Or some of the patients even have been abused, or, some are immigrants and they're trying to get their foothold here in this country. And so, it takes wanting to serve, and help other people. And
it's not just about fixing the tooth.
No, it's helping the people. And we do get focused in on the particular procedure we're doing today, but the main thing is making sure that we can help a person to hopefully turn their life around, or to be able to go out in public and smile like they haven't been able to do for a number of years because this tooth had a big hole in it in the front or something like that. Sometimes it's the simple things. Or we can clean their teeth, and God bless the hygienists that come here and volunteer their time. What the scripture says is that, what you do for the least of my people, you do for me. And so that's been my major motivation, just to help others. I mean, I've helped more people in my career than I can ever count. But and it's been a very rewarding career. And so because of that, after I sold my practice and retired, I came to this clinic and started giving of my time here.
Let me ask you this. There's bound to be at least one story that has affected you in terms of a patient. Is there one off the top of your head that either through the relationship or bonding with them, is there one thing that just sticks with you forever?
There have been people that I've helped that haven't been able to smile for years. And I see so many because the demand is so great. I can't single out a single individual patient that, because being in the profession as long as I have, I care for all the patients that come here. Even though some may not need total extensive rehabilitation, some just don't need anything except a cleaning, and that's fine. But you care for all the people that walk through the door. You try and do the best you absolutely can for them. Okay.
I would assume in your profession, the last thing one of your colleagues wants is for you to pressure them or say, hey, why don't you come help out at the clinic? How do you approach a professional colleague and saying, maybe you want to give some time to this person?
Okay. Well, we just, at the latest Dental Society meeting, Sally and Monica and myself, I was there, and we all spoke a little bit about serving the people here in this community. And now, dentists are, for the most part, pretty actually giving people. I mean, they're blessed with, a good standard of living, and although they work long hours, and they're, I explained to the other dentists that, they're very accommodating to their schedules. We can, as dentists, we're trained in multiple different procedures, and we're taught certain ways to do things, and the clinic makes an effort to adapt to the different styles of practice or materials that some dentists like to use. We're blessed that sometimes when dentists retire from this area, they'll donate some of their equipment and supplies here. But I told the dentist that, there's a great need for the patients, and that we will accommodate their schedules so that it's not a burden on them to come in and practice at the clinic. And I think that's a beneficial thing for everyone who comes here. And some of them eventually, they fall by the wayside with, either back injuries or they start having neck problems, and one has carpal tunnel or this or that, and they can no longer really practice. So we do have a little bit of a turnover in that sense, but we do have dentists with, I tell these patients, we have some of the best dentists around. We've got 150, 200 years of dental experience, because these are good dentists that have made a living doing it for many, many years, and they're retired and they want to give back. And it's not a hard sell, but I think they find it enjoyable to continue giving, because we all like to help others, and there's nothing more rewarding in your life than knowing you made a difference in somebody else's life.